I initially heard about the Wiley protocol from one of my patients who had read the book Sex, Lies, and Menopause. And of course, initially I thought there's no way women would do this dosing, and the estrogen was way too high, and I thought she was crazy. And so I kind of put it aside, and then a pharmacist had come across it, and I ended up talking to T.S. Wiley on the phone for 2 hours, and I got a 2-hour lecture on everything that's good about the Wiley protocol, and I was very impressed because I've done hormone replacement therapy and looked at it since 1993. I listened to Christiana Northrup and Jonathan Wright and Terry Hertog and all the people in the A4M. I've gone to the American Holistic Medical Association. I've been all over the country trying to understand what works for women. It was very important to me to figure out what was safe, what was the science behind it, where are the studies, and I was looking for answers because how I had been doing it was good, but it still wasn't quite right. We didn't have it quite right. Women were doing okay, but they weren't doing, you know, there were problems, and nobody could answer my questions of why there were problems. And so once I ran into her and she started to be able to answer my questions, I was very impressed and I wanted to learn more. Since I've started using this on my patient population, I've switched everybody from the linear dosing of Bioestin progesterone into the rhythmic dosing of Wiley. And initially there is always some adjustments, some side effects, some breast tenderness. Women may get a little bit more irritable, they may have some breakthrough bleeding, and I tell my patients to expect that. But by 3 months, when the receptors are all up and running, people feel very good. I've seen improvements in migraines. I've seen libido improve, vaginal dryness improve, insomnia improve. I've seen no one has gained weight on this protocol, which has been a big issue. Before this, no matter whether women took Prempro or they did no hormones at all or they did the linear hormone dosing, everybody gained 5 to 10 pounds at menopause. Now I don't see that. Nobody has gained weight, which is a big deal to women. Also, the other thing that's a big deal to me is I see their cholesterol levels come down, their inflammation decrease, and I can prove it with lab tests. Their bone density, some of these women were osteoporotic, and a year after they're on the protocol, I've seen either total reverses of the osteoporosis or reversal of the osteopenia and a significant improvement in their osteoporosis. And I think if I give it a couple more years, they will not have osteoporosis. And so it's been a very pleasant surprise to see in such a short period of time that their bones coming back to normal.